So this is probably one of the easiest ways that you can get some rotation in the hips. So a lot of the time people will sit down and put their leg over and try and push their leg to try and stretch their glutes, stretch their hips, open up their lower back. If they've got back pain, knee pain, they've been told they need more rotation or external rotation in the hips, that their glutes are tight or sore or stiff. So there's two ways to do this. We can firstly start in a 90-90 position, 90-90 being the hips are at 90 degrees and both knees are at 90 degrees. Sometimes even just sitting in this position upright is challenging. Most people sort of fall off, or they'll use their hand to sort of prop themselves up. They can't really sit in this position comfortably as a resting position. So that just shows a lot of restriction in both internal and external rotation of the hips and the spine as well. But if we're looking at external rotation, we'll be leaning towards our front hip, bringing our chest and our head down closer and closer to this front one. If we're trying to get some internal rotation, the wall's in my way, but what I'll think about doing is pushing this back leg down as hard as possible and leaning back as far as possible. And then obviously swapping and doing that on both sides as well. If your glutes, your hips, your lower back is super, super tight, and even getting on the floor in those positions is challenging for your knees, for your ankles, for your hips, for your spine, even some people for their neck and their shoulders, by holding their own body weight is sometimes challenging. So what we can do is we can just use a wall to stretch our glutes, and we don't actually have to use our hands or anything to push them down. We can use our own body weight to guide us into that position, and our own body weight to stretch us into that position. So coming as close to the wall as possible, sitting your bum right up, spinning the legs around. You might need to shuffle back just a little bit. So from here, the higher your feet are, the easier it's going to be. The lower your feet are, the harder it's going to be. The closer to the wall, your bum, the harder. The further away, the easier. But essentially all we're doing in this position is putting our ankle, outside ankle, on or just underneath the knee, and then resting. So you can see this little gap on my butt. That's using my body weight to actually push down so I can get a good stretch in this outer hip and the side hip and all these tissues that help allow us to get into better external rotation. So you don't need to use any force. You can sit and just stay here for 2 minutes. Breathing in the nose, into the diaphragm, out the mouth with pursed lips, slightly putting some tension into your deep core, not flexing your abs, not tensing. You should be able to hold this position comfortably for 2 to 5 minutes and be able to hold a conversation in that position. If you're struggling, it's too sore, it's too tight, you're shaking, you're flexing, you're trying to move around, you're going too hard. This is just as much as the central nervous system calm down as it is a musculoskeletal system thing. We need to train and teach the body that these positions, these stretches, allowing the tissues to go into these positions is safe. So we should be able to hold a nice conversation, nice nasal breathing into the diaphragm, out through the mouth, core slightly tensing, slightly firming, bracing just a little bit, and relaxing. 2 minutes both legs every single day. The wall is the stretch, the ground is the dynamic stretch. You can start to get into lifting the leg and moving it around to get some strength, some hip flexor work. Spend some time on the ground, get into the knees, into the Caesar position, get the feet active and stretch the front, get into the fronts of your shins, the toes, get in underneath into the cow position, stretch out those toes, get back, lean back more, play around and explore. Hope that helps. Peace.